I'm Dr. Felix's dental hygienist. And this is Valerie, my lovely assistant, or also Dr. Felix's dental assistant. Today we're going to demo how to floss correctly. We're also going to mention why you should floss and the different devices you can use to floss.
What happens if they don't floss?
Well, if you don't floss, which is also the reason why you want to floss, you have bacteria between the teeth, or plaque. Plaque is sticky, it's called the biofilm, and it adheres to the tooth. And you can only remove it mechanically, so that would be with your dental flossing, scraping up and down against the tooth, or also with a water pick, which we would be demoing at a different time.
What happens if we don't remove the plaque?
Well, if we don't remove the plaque has bacteria in it, and that bacteria will sit between the teeth and the gums, and if it's combined with any type of sugar, whether it's natural sugar, fruit, or candy, it'll produce an acid. And the acid actually eats away at your tooth, and that's how you get a cavity. You get cavities if you don't remove the plaque. You can also get periodontal disease or gingivitis, which is inflammation of the gums, or periodontitis, which is actually bone loss.
There is a wrong and a right way of flossing. Why don't you show us the right way to floss, Dora?
Alrighty, Val. So you would like to get a piece of floss about a foot long or longer. You're going to wrap it around your middle fingers. Hold on to it with your pointing finger and your thumb, and you're going to want to leave about an inch between. Have about an inch in between. And now we're going to wiggle back and forth to get between the contacts of the teeth. Once you're between, you want to wrap it around the tooth or hug the tooth and go up and down about 3 to 5 times. And then wrap it around the other tooth about 3 to 4 times. And then you're going to wiggle it back out. Sometimes I know some of my patients get the floss stuck and they can't pull it out. It is okay to pull it out through the side. Anything else that's new, the more practice you have, the better you'll be at flossing.
What happens if you can't use your fingers for flossing? Because we do have some older patients that aren't able to floss.
Yes, Valerie, that's a really good question. So if you're not able to floss with your hands, they have these little floss picks. So the floss is between the little plastic sticks, and all you do is, it would be almost the same thing. You're going to wiggle back and forth to get in between. You're going to pull against the tooth, go up and down against the tooth, and then you're going to push against the other tooth and go up and down and wiggle it back out.
Go. Dora, what happens if your gums are bleeding while you're flossing?
That's a good question, Valerie. Sometimes if you haven't flossed on a regular basis, your gums will bleed a little bit. But if you get your teeth cleaned and you floss daily, twice a day, for about 2 weeks, the bleeding should go away. If for any reason it does not, you should contact our office for further evaluation.